Hi, I'm Jay McCallum with Core Balance Therapy, and today I wanted to talk a little bit about some shoulder exercises that I use a lot with patients. Thinking about trying to keep the shoulder strong, keep the rotator cuff strong, and really keep the tendons really of the rotator cuff stimulated and strong and robust, because it seems like tendon pain is a big piece of what we see with shoulders. So I'm going to start with just a simple dumbbell raise. It's just a reach up like this. I encourage folks to just shift their weight into it and reach a little bit, just as if you're reaching into a shelf. Want to use enough weight that you're challenged to do it more than, say, 12 times or so. So if you're feeling like it's really easy to do 12, you need a bigger weight. And if you can't do it at least 10 or so, you probably need a lighter weight. So simple reaching like this. A couple of exercises laying on the side. These are really targeting the back of the shoulder. I like this big sweeping pattern, really controlling the lowering so it's not quick and pulling back up. This exercise is called a Powell raise. Really nice way to work the back of the shoulder, which is a part of the shoulder that we often neglect. So a big sweeping pattern like this. Another way to get into the back of the shoulder and work a little bit more on rotation is to just prop your arm on your elbow or your elbow on your knee and do a simple rotational movement. Thinking about making sure that it's really a shoulder movement. You're not twisting your trunk or doing a movement like this to generate it, but just lifting like this. A nice rotation movement. And then lastly, a push-up is a great way to train the shoulder. And I just encourage folks to find a surface that they can control well. So doing them all the way to the ground is more challenging, but doing them to a tabletop or a countertop or something like that can be a very nice way to make it easy enough that you can get somewhere into that 8, 10, 12 repetition range and get a good workout. So shouldn't feel like this is painful. These are exercises that are great training for the general population. If you have a really painful shoulder, they may not be appropriate for you. So if you're struggling to get started with an exercise program, feel free to give us a call. And thanks for listening. We'll talk to you again next week.